Hi vets, this video is just for you. In this video, I'm going to explain how to approach a writing task, how to use your 5 minutes reading time effectively, how to demonstrate the 6 assessment criteria in your writing, how to use the sample answer provided, and how to learn from completed writing tasks. So let's get started. The Veterinary Science writing test includes 4 possible types of letter: referral, discharge, transfer, and advice or inform. The reader of your letter could be to a number of different healthcare professionals or to the owner of the pet. For example, vet to vet, vet to specialist, vet to owner, etc. Until you turn over the test booklet at the start of the reading time, you don't know which scenario it's going to be. The most important point is to be prepared to be flexible to meet any one of these letters and readers. Every pet is different. Their background, their medical history, their current situation, these will all be different. Just like you wouldn't speak to each owner you meet during your working day using the same language and expressions, you need to be ready to use language and paragraph structure to make your letter personalised to this animal and this situation. Only then will you be demonstrating to the assessors that you have the English required to score a B grade or higher. Turning over the test booklet, there are 3 things you want to check as a priority. Although you cannot highlight or make any marks on your test booklet in the reading time, I'm going to highlight these 3 things so you can clearly see what my eyes are looking at and can follow the approach yourself. The first 2 pieces of information are provided at the end of the case notes, so go straight there first. Who are you writing to and what is their job role? Here we can see that we're writing to Dr. Gray, who is the client's usual vet. What are you writing to the vet about? You are writing to provide a post-operative check and follow-up treatment. Back at the start of the case notes, you will find the 3rd piece of information. What is your role in this animal's care? You are a vet in an after-hours clinic. You have performed emergency surgery on Cherie, an 8-year-old female Burmese mountain dog. Before I start reading the case notes from the beginning, I want to make sure I have completely understood the reason for writing the letter. So another good place to check for any detail about this is the last information in the case notes. From here, I can see that the dog has been discharged and that the owner will return to the regular vet for a post-operative review, removal of stitches and further treatment. With this in mind, and remembering the specific reasons for writing this letter to request a post-operative check and follow-up treatment, I can start reading through the case notes line by line, deciding whether each one is relevant to the reader or not. To help make the decision, I will ask myself 2 questions each time. Is this case note relevant to the current situation? And will this case note affect how the reader continues care for the patient? If the answer to both questions is no, I can omit this information. If the answer to either question is yes, I will include this information somewhere in the letter. In the reading time, you have to make mental notes as you read for your understanding. I'm going to highlight the notes which I pick out to be relevant, so you can see what I'm doing. I notice the case notes start with a date, so I skim down the rest of the case notes looking for other dates. But there's only one more, which I've already seen is the date of discharge. So returning to the top, the owner's information and the animal's information are both going to be important to mention as part of my reason for writing. The history details and the clinical findings are all going to be important points of reference for the reader to understand why the emergency surgery was needed. The diagnosis will also need to be recorded as part of the reason for writing. From the treatment section, I know that not everything is going to be necessary to mention because the surgery has been successful. I pick out the IV information and the pain relief, as well as the decompression of the stomach, and then the particular type of surgery performed, as well as the recovery being uneventful. In the section of advice provided to the owner, I notice that the first point is now irrelevant because the surgery was performed, but the 24 hours of observation and the vital signs now being normal are something that I will need to mention. Having reached the end of the case notes and talking myself through the situation, I now feel I have a good understanding of Cherie's history, but also how I'm going to structure my letter. If I still have time left out of the 5 minutes reading time, I would read through everything again carefully, reminding myself the decisions I just made. Once the writing time starts, I would now underline those notes which I highlighted for you, so I have a clear record of the information I want to include in my letter. I would also turn to the blank page on the back of the answer booklet and make a very rough plan of my letter structure. In the introduction, I will explain that emergency treatment was provided for one of the reader's patients. In the middle paragraphs, I will summarise the presenting symptoms, the clinical findings, and the treatment provided. In the final paragraph, I will make the requests of the reader. I'm now ready to start writing. I have a clear plan in my mind, and it should be easy to record all the information in the 35 minutes I will have left, and still keep some of this time to check my work at the end. I'm not going to write the whole letter now, but just to point out a few things. Opening my answer booklet, I'm going to start with the reader's name and the address, which I can copy directly from the writing task. Underneath this, I will add the date, which is today in the case notes, 30th of August 2019. Next comes my greeting, Dear Dr. Gray. Then will come the body of my letter, the paragraphs. The introduction, introducing the reason for writing, then the presenting symptoms paragraph, the clinical findings paragraph, the treatment paragraph, and finally the requests paragraph. Underneath all of this, I will add my ending, yours sincerely, and finally my job title, veterinarian. As you write the paragraphs, think about how you will summarise the information. The aim is not to write one case note per sentence. For example, the details of the surgery can be summarised into one sentence. Once you have finished writing, use any time you have left to check your letter against the case notes you underlined to make sure you have included everything you identified was relevant. Read it as the regular vet. By the end of the letter, do you understand Cherie's situation and what you need to do for her? If necessary, make edits to your letter if anything needs clarifying or adding. Now you have your completed letter, it's time to look at the sample answer. There are some important things to remember with sample letters for official OET tasks. They have been written and checked by both language experts and a vet subject matter expert to make sure they are accurate medically and linguistically. That doesn't mean they are perfect or seen as the only way to write a letter about these case notes. You might have used slightly different language or structure to your letter. Provided you have communicated the situation as per the task clearly to the reader, this will not be a problem. When reading the sample answer afterwards, notice the similarities and differences. If there are any differences, rather than seeing it as something that has to be corrected in your letter, think about why it is different. Why do you think the writer used this word or phrase? Is it more formal? Does it allow them to summarise some detail more effectively? Why do you think they structured their letter like this? Is there any difference in clarity between your version and their version? I want to finish off by giving you a few tips about how you can get the most out of this set of case notes after you've written the letter. Don't just discard this task and letter and move straight on to another task. Take time after each practice letter to learn from it and avoid making the same mistakes next time. Here are 5 things you can do to get the most value out of each practice task you complete. Assess your writing and the sample answer against the assessment criteria. The criteria are free to download from the OET website and contain both a description of the 6 criteria you are assessed on as well as the evidence of what the assessors are looking for to be able to score you at the different levels. Take each criterion in turn. Read the evidence statement for each level and critically decide which statement is the best match for your writing. Type your letter into a document and check your language and grammar by using free tools such as Grammarly or the spell checker and grammar functions built into your word processing software. Notice the mistakes that are picked up and use them to create your own checklist of common errors to learn from. Rewrite your letter so you have a perfect copy to refer to as you revise. If you keep looking at your original letter with the mistakes in it, you are training your brain to remember the mistakes. Having a perfect copy to revise from will help improve the accuracy of your writing. Use the case notes as the basis for a speaking role play. Imagine you are having a conversation with Mrs. Kent in August. Ask a friend or colleague to play Mrs. Kent's role while you explain your findings and the need for surgery. Search the internet for podcasts on stomach surgery or medical journal articles covering recent developments in the treatment of the condition to practice your skills for the reading and listening parts of the test. With the right approach, the writing test is something everyone can do well. For more videos and test strategies, follow our social media channels on Facebook, YouTube and Instagram @official OET, and search the OET blog available on our website.